So what do you understand by the term equality and diversity? What does it mean to you? What background knowledge do you have about the topic? It's important that you think about equality, think about diversity, you think about inclusion, because it is understandably a much recognised topic within the NHS and indeed in education, government departments, in industry, and rightly so, as I will explain as we go through this video. And I suppose, why would it appear in medical school and dental school interviews? And again, I think there's good reasons for that. Understand that, diversity, inclusion, these are key terms around employment, around looking after patients, around respect and understanding of people from different backgrounds. So you see, we kind of need to get our heads around these important concepts and key words such as diversity, and look at what's the definition of diversity. Diversity, if you was to define it, if you ask me to define it, it's probably something about the presence of different types of people within a population. So it could be within the population in the UK, it could be the population of the NHS, it could be the population within your GP surgery or dental surgery, it could be within a local community or the council or the school where people work at, or the company that somebody might work at. And in the context of the NHS, it means no different. It's the fact that you have people from different backgrounds working within the NHS, being treated within the NHS, and and they're diverse people. They're different in terms of their ethnicity, in terms of their gender, in terms of their religion, in terms of culture, socioeconomic background, their abilities and disabilities. So it's important to take all that into account. I'm sure you already know the UK, one of the great things about living in the UK is we are a mixed population. There's people from a multitude of different parts of the world. We vary culturally, different ethnic backgrounds, religions and cultural norms, colour, creed, gender. And it's no surprise that the NHS is simply a mirror, a reflection of that. Over 200 nationalities are working within the NHS. It truly is a global workforce. And with having such a global workforce, it's important that this richness enhances the environment in which you and I work in, but not only that, it enhances the care that we deliver to our patients in terms of their perspective, in terms of their experience. So diversity is not just about visible, it's also about non-visible differences, i.e., the neurodiversity amongst us, the mental health amongst us, things that can't necessarily be seen in terms of the clothes we wear or the physical abilities and disabilities that we may or may not have. Okay, so having dealt with diversity, what do we mean by inclusion? Well, I would say inclusion is something about everybody feeling included, right? They're included in terms of values. They feel their values are included. They feel they are being respected. They're feeling supported. And, and it's got nothing to do with their background or anything. Everybody needs to be included, respected and valued regardless of background and circumstances, all right, abilities and disabilities. And again, in terms of a few kind of bullet points, if you like, around inclusion, I would say that we need to include people and provide equal access to opportunities and resources, i.e. provision of resources within a department, within the hospital, within the surgery, access to promotion, to jobs, to welfare benefits and so forth within the working environment, holidays, sick leave and so forth. Everybody needs to be playing on the same field. So that needs to be the case for colleagues, but also your patients, regardless of their background, race, color, creed, gender, whatever it might be, they need to be given the same platform on which they receive care, the same provision of care in terms of medication, in terms of surgery, in terms of prioritization and so forth. It should be equal. regardless of people's background. And also we need to accommodate individual needs. For example, does our patient struggle to communicate in a certain way? Are they blind? Are they not able to speak English because they've come to the country recently? In which case we need to afford the necessary, services to help with interpretation, to help with facilitation, to help with accommodation, whatever it might be. We can't abandon the needs of our patients. But in all of that, let's make sure we are clear on some key concepts, right? So take, for example, equality. What do you understand by equality? And then how is that different to equity, right? Make sure you're clear about that. And especially when you're discussing ethical angles, right? You're going to have to think about equity and equality carefully. Equality is about treating everybody the same. So like, Tom, Ahmed, Samuel from different parts of the world working in the NHS, we give them equality of opportunity, equality of job access, equality of resources, right? That's equality. However, you've got, a surgery list, right? Somebody needs a hip replacement, somebody needs a fracture of the hip that needs fixing, somebody's got a multiple fracture of one of the legs from an accident. Everybody needs surgery, but the surgeon and his team or her team will decide on who needs it first and who needs it last, or who can wait and who can't wait. So it's about equity here. It's not necessarily about giving everybody surgery today and at the same time. No, it's about doing what's right, and that's equity for you, okay? It's about, and this is involved in rationing. This is involved in deciding who gets an organ transplant, for example, or who gets to be at the top of the pecking order when it comes to IVF treatment, for example. All right. Also, I think as professionals, we need to be competent in terms of cultural awareness, our ability to understand and communicate with people of different backgrounds. So some kind of cultural competency that's required and that requires you and I, we can't learn about everybody and everything, but what we can do is try and be aware. For example, let's say there's been an influx of refugees from the war you've got in Ukraine. We've had an influx of refugees and people from Ukraine. Let's try and understand their health views, how the people from Ukraine see health and view health. Let's try and understand their food, their language, their religion, and so that we can look after them in a better way. I think it's the right thing to do as a host community when a new community comes to you and they may have needs, and we need to try and meet those needs. Let's also not introduce bias there that may affect the care or the provision we provide to our Ukrainian, cohort of patients that come to us. Do we have any biases? Do we have any anything, especially anything that will endanger that sacrosanct, patient safety and facilitation of care? And then another word I want you to remember is intersectionality. What do I mean by intersectionality? Well, that's all about a framework, right, of understanding, people holistically. So let's say, Mr. Krakow from Ukraine comes to you. Apologies if I've got it wrong. I don't know if Krakow is this Ukrainian surname, but I'm assuming. But you know what I mean, where I'm getting at. We need to see his needs from his gender perspective, from his race perspective, from his socioeconomic background perspective, from his health belief perspective, from his cultural norms, health beliefs and health norms perspective, so that we can provide him effective care and perhaps his unique needs that might bring forward, and if that falls within the remit of NHS provision, of course. Okay, so why is that so important in the NHS? Well, first and foremost, it's about better patient care. The more we include our workforce from a diverse background, I believe, and we believe in the NHS, that we can provide better care. We can understand our patients better, and we can meet often their needs better. Often, having different beliefs and understanding about their healthcare, so we can deliver better care in that sense. We believe by understanding, diversity, inclusion better, we can then do equity in a better way. We can decide on who needs what in a more informed way, and approach unique challenges, I suppose, in a more appropriate way. Here also there's probably a couple of legal aspects you need to think about, and one of them is the Equality Act of 2010 that got updated from 2004, I think. So the Equality Act of 2010 talks about protecting individuals from discrimination in the workplace, and also those that receive service. And of course, this is then enshrined in the NHS Constitution, which you and I should be very much aware of, which is a commitment, right, of providing care in a comprehensive and holistic way to people of whatever background, race, culture, creed, or whatever. In the NHS, by being, focused on diversity and inclusion, we believe we uplift the morale of our workforce better. We believe we meet their needs better, therefore it leads to better workforce retention. It leads to better workforce work satisfaction. It also leads to better problem solving, managing problems better, because we understand our workforce better and we understand our patients better. And there's lots of evidence, growing evidence, of showing that there's actually improving and increasing innovation and research happening in a more diverse and inclusive environment. I hear you're asking me, well, what are the challenges? All right, because that might come up in scenarios, in questions. Well, so I guess I want you to think about challenges are, for example, health inequalities. We face health inequality among patients, of course, but also amongst our staff, our colleagues. So that then affects health outcomes. That then affects people's ability to work effectively. So the more you address diversity and inclusion, the more you reduce health inequality. We also see that improving diversity and inclusion and knowledge of will reduce workplace discrimination, i.e. access to job, unconscious bias, discrimination, microaggressions, and so forth. These things actually reduce by educating people, training people about diversity and inclusion. We also see that, as I said before, because you are aware of diversity and inclusion, you are aware of meeting patients' needs and colleagues' needs better. So that access to language services, any communication barriers that you might come across, you manage those issues better and those needs better. You also reduce systemic, barriers, such as structural rules and norms, lack of representation or over-representation of certain cohorts within meetings, within decision-making bodies, within review bodies, and so on and so forth. And if anything, what that does, because you're addressing that, you're actually reducing hindrance on progress, on work being done better, care being provided in a better way. As organizations, we also need to think about stigma, especially mental health stigma, because colleagues and patients alike might see certain situations differently, whether it's stress, whether it's mental health issues. They deal with it differently and they have different cultural health beliefs. And it's important to be able to formulate and understand that as part of our delivery of care, delivery of provision for patients and staff alike. So how do we, on a day-to-day, week-to-week, month-to-month basis, how do people like me get involved in improving and promoting diversity and inclusion within our working environments in the NHS? Well, I can think of a few that I can tell you about off the top of my head. And one is, at work, we have training and awareness campaigns amongst staff so that we learn about each other. We learn about our patients, especially the key cohorts that we need to focus on. And so you do regular workshops, regular updates, and this helps. It can't be a one-off thing. It has to be an ongoing thing. And in our organisation at work, it's an annual thing where we look at training on cultural awareness, on diversity and inclusion issues, anything new, any new legislation, etc. When it comes to recruitment, we're very much kind of inclusive. We don't discriminate people on gender, on age, on background, colour, race, creed, in any shape or form. You just cannot do that. And you need to be hiring people, recruiting people based on merit. And Yeah, and then also, for people who, may not have come through the traditional routes of degrees and so forth, you've got the emergence of apprenticeship schemes, of schemes like, you've got TNAs, the trainee nurse associates, for example. You've got the trainee doctor scheme that's up and running in the UK already. And what that does, it allows people from non-academic background in some cases, and also people with practical experience to come into these professions without necessarily having to go through the traditional routes of academia. Because again, there's strong evidence building around, people from different backgrounds can be very good at delivering these jobs. In leadership, what we find is there is positive discrimination going on sometimes. So, for example, we will want patient representation, we will want female representation, we will want representation from certain sections of the workforce and patient community, and so that we've got as much diversification in leadership, in policy making. We, understandably, where it involves patient care, we try to keep the patient central to what we do. So in advising, in delivery, in working with those, there's always like patient groups, expert patients, representation involved. And in our training of healthcare professionals, we are constantly talking about patient-centered care. It's what the patient feels appropriate rather than what you feel appropriate. Of course, there's something where the patient is wrong or perhaps ill, informed about what needs to happen, and you as a healthcare clinician need to try and resolve that. But you cannot ignore patients and their opinions. We use monitoring as a way, so data collection and analysis of data, to develop policies and guidelines and working practices so that we constantly encourage diversity and inclusion. We're flexible as well in our policies, in service delivery, in our decision making, so that should there be changes needed because of, changes in the population or something going on locally, we can then adapt quickly. We can be efficient in the way we do these things. One or two examples in the NHS, we have the WRES, which is the Workforce Race Equality Standard, and that's all about framework improving experience of staff and people from ethnic minority backgrounds. You've got the LGBTQ support networks, and that's set up within the NHS that helps to promote an understanding of LGBTQ issues and activities to help support the understanding of the said community. We also have the accessible information standard that we work to, and that's about making sure patients with disabilities and language needs have the information in the appropriate format so that they can understand consent and capacity issues are addressed better way that way. There's the HIT program, Health Inequalities Information Program, and that's about reducing disparities in health outcome for vulnerable population, so elderly population, learning needs, etc. So what I need you to do is get a good feel for this topic, all right, read around it. In the real interviews, what you want to do is try and talk about kind of examples of what you've read, what you've come across during work experience, what you've seen in the news, for example. You need to demonstrate that you're aware of these concepts. They're not asking you to be an expert, but they'd like you to be aware of important issues like this. Try and talk about NHS's core value, respect, dignity and so forth, commitment to quality care. Try and talk about and reflect on your own experiences from work, from volunteering, from work experience, and where possible, your ability to learn and adapt and openness to these issues. And if you can use data as facts where possible, then that's great also. Questions. Have I seen questions on this? Yes, I have. I've seen absolutely bucketfuls of it in the past few years. Questions like, for example, what do you think about diversity and inclusion? Is it important in the NHS? Can you provide an example of, from work experience or volunteering, etc., where you've worked with a diverse team, and talk about that? How can we ensure inclusivity with patients from different backgrounds? How can we promote diversity inclusion in our workforce? So loads of these type of questions. I've got loads of them in the online course, so do feel free to access those. And again, keep practicing, do some reading around the key concepts I've raised here, and hope you have a better understanding of it. Thank you very much.